Hi, this is the second video for option number 4 in the Managed Transfer Decision document. I will be demonstrating as the surgeon entering in post-op orders before anesthesia has entered in their PACU orders. So I'll open up the patient's chart in their order section. There are some orders remaining from when the patient was preoperative. So I'll go ahead and start my managed transfer. I will select my location where they're being transferred to, and then go ahead and reconcile my orders. Because anesthesia has not entered in their PACU orders at this point, I will not see any orders from them in the managed transfer. Again, most orders have defaulted to stop, with some orders defaulting to continue, such as lab orders. At this point in time, I will just accept that these medications are being stopped as I want to enter in my new orders, and I will go ahead and enter in my post-operative order set. And when I'm happy with that, I'll resolve any conflicts and go ahead to preview. We can see that my new orders, any orders I've continued, and orders I've decided to stop. And I will submit, enter in my. So we now have a pending transfer.
Thank you, surgeon. So at this point, I am in the patient's chart. I am the anesthetist. I'm going to click on orders, and I'm going to be prompted to decide whether I want to go into the transfer orders, which would be the orders that are initiated when the patient moves to the ward, or just the current orders. I'll click on current orders, and I'm going to go to enter, and I am going to submit my usual PACU orders. I'll just show a couple. Perfect. And I'm going to hit submit. So because there was already an existing transfer that had been initiated by the surgeon, when I entered my PACU orders, I was brought straight to the transfer screen. And as we can see, the new PACU orders that I initiated default to stop. And if for whatever reason I wanted them to continue on the ward, I could continue them at this time. And this is also the screen where if I don't want to use the hold queue, I can add my ward orders that'll be initiated at the time of transfer. So as per the previous example, at this point I could put in my PCA medications as well, which I won't demonstrate. But now that we can see that I've added a new medication that will only be made available once the patient is, or once the transfer is processed. So back to the order screen, we can see that my PACU orders are active, and these are going to be set to discontinue at the time of transfer.